Nursing assistants may help support individuals with a common developmental disorder called Down syndrome. Individuals with Down syndrome also have common physical characteristics based on its genetic cause, related to an excess 21st chromosome. People with Down syndrome typically experience mild to moderate severity levels of intellectual disability with associated adaptive behaviors regarding daily life activities as previously described. Chromosomes can be thought of as small packages of genes in the body that determine how a baby forms as it develops during pregnancy and functions after birth. Typically, a baby is born with 46 chromosomes. However, babies with Down syndrome have an extra copy of chromosome 21. The medical term for having an extra copy of a chromosome is trisomy, so Down syndrome is also referred to as trisomy 21. This extra 21st chromosome causes common physical features for individuals with Down syndrome as seen above and in the following slides. Common physical features of individuals with Down syndrome include the following: a flattened face, especially the bridge of the nose, almond-shaped eyes that slant up, a short neck, small ears, a tongue that tends to stick out of the mouth, tiny white spots on the iris, colored part of the eye, small hands and feet, a single line across the palm of the hand, palmar crease, small fifth fingers that sometimes curve toward the thumb, poor muscle tone or loose joints, shorter height as children and adults. Most people with Down syndrome have common facial features, but no other major birth defects. However, some people with Down syndrome have other major birth defects and an increased risk of medical problems such as heart or thyroid disease. Common health problems associated with Down syndrome are as follows: hearing loss, obstructive sleep apnea, breathing temporarily stops while asleep, ear infections, eye diseases, heart defects present at birth. Individuals with Down syndrome typically enjoy socialization and being part of a group, and finding ways to give them recognition for their achievements is important. For example, during school years, activities like helping with athletic teams are often enjoyable. After high school, employment provides feelings of self-esteem and achievement, because these individuals thrive on encouragement, allowing them the opportunity to be as independent as possible and achieve their personal goals greatly increases their quality of life. Independence can range from completing ADLs independently, completing school coursework, or gaining skills from a job.